today we're going to talk about women's health for average risk women. Know that there are some women that are at higher risk for different diseases because of family history, such as breast cancer, colon cancer, family history. So I'm talking to those that are at average risks. Breast cancer screening, I just want to give you some statistics on this. 1 in 8 women will be diagnosed with breast cancer this year. Breast cancer is the second leading cause of cancer death in women. Lung cancer is first. And the American Cancer Society estimates in 2019, 268,600 new cases of breast cancer will be diagnosed, and 62,930 will be carcinoma in situ of the breast, and that is the earliest form of breast cancer, non-invasive. Approximately 41,760 women will die from breast cancer in 2019, it's estimated, according to the American Cancer Society. So on breast cancer screenings, I follow certain breast cancer screening guidelines. There's multiple, and we're going to go through some of the different guidelines for the different screening tests that are there. Who's to follow? I follow the American College of Radiology. Annual screening mammogram, age 40 for women at average risk for breast cancer, and annually thereafter. And the reason why I do this at age 40, because some of the guidelines you're going to see state that we should start at a later age. According to the American Cancer Society in 2017, women aged 40 to 49 had 20% of carcinoma in situ of the breast, meaning the earliest form of breast cancer, and invasive breast cancer in this age group as well, 40 to 49, were 15%, 36,920. And so I say if there's 36,920 of invasive breast cancers, I want to be screening for those invasive breast cancers, and I want to find the earliest form of breast cancer, the carcinoma in situ. Deaths in this age group as well, 40 to 49, and this was in 2017, 9%, 3,480 age 40 to 49. I say women age 40 to 49 are worth a mammogram screening every year, age 40 and older. Talk with your doctor. Your doctor may go through by different guidelines, but all of the guidelines say a woman age 40 should be able to choose an annual mammogram if they so choose to. The American Cancer Society's guidelines say women of average risk of breast cancer, most women should begin at age 45. Although again, here's this caveat, women who are age 40, if they wish to do so, starting to have a screening mammogram at age 40. They just need to talk to their provider. And then their recommendation is at age 55, patients should begin every other year for annual or biennial screening mammograms unless they wish to continue to do annual, and I continue to recommend annual. United States Preventive Services Task Force recommends women before age 50 should have a discussion with their provider, and the decision to have regular every other year screening mammogram before age 50. You have to know the patient's values and the benefits and harms. So harms could be more invasive testing, biopsies, things like that, that might be benign. And so that's their reasoning for that. But their guideline says women 50 or older recommends biennial screening mammogram, age 50 to 74. Age 75 or older concludes there's not enough evidence for benefits and risk for harms for screening mammogram for women 75 and older. And I'll just say in 2017, 10,370 cases of breast cancer in situ for that age 70 to 79. And invasive breast cancer was 19% at 47,860, still in this age group for breast cancer.
In 75, age of 75 or over? Wow.
70 to 79.
Wow.
And it goes down 80 years old and older, 3,760 breast cancer in situ cases, and 30,080 invasive breast cancer. So they're still there. My mother still has a screening mammogram and she's 80 years old. She's not going to stop.
Well,
so it's a discussion to have with your provider. Are you okay? Okay.
I'm confident, all right.
Cervical cancer is another cancer that, we have screening for. We have Pap tests that we can do. And so there's different guidelines for Pap tests as well. American Cancer Society estimates that there are, in 2019, 13,170 invasive cervical cancer diagnoses and 4,250 deaths for cervical cancer. There's a screening test that we can do. And so that's the importance. I'm always on prevention because I think prevention is where it's at. Our society for years and years have been, let's go to the doctor when we're sick. I'm well, I don't need a doctor. But these are the things that can be early detected, and early treatment saves lives. And that's why I'm a big proponent for preventive services. And I hope everybody starts to have that kind of focus. American Cancer Society says all women 21 years of age to age 29 should have a screening Pap test every 3 years. The high-risk HPV, the virus that causes most cervical cancer, is not recommended in this age group. And the reason why is because if they are infected, many times it clears on its own without any intervention. HPV tests can be added if they have an abnormal test. So say I have a girl that comes in that's age 22, she has an abnormal Pap test, they automatically reflex that a high-risk HPV on my test because I want to know, but it's not routinely done for just everybody. Age 30 to 65, we do the high-risk HPV and Pap test together. It's not a different test, it's still in that thin prep vial, but we do it together. And they recommend every 5 years. Another option for 30 to 65 years of age is a Pap test alone every 3 years. And then their guideline for women 65 and older who've had regular cervical cancer screening in the past 10 years, as long as they've not had any serious pre-cancer or cancer in the past 20 years, CIN1 or CIN2, they can stop screening. But I would recommend that they have that that co-test within the last 5 years. The American College of Obstetrics and Gynecology, they recommend age 20 to 21 cervical Pap test every 3 years. 25 and older may consider the high-risk HPV co-testing every 3 years. And then age 30 to age 65, one of the following methods, either co-testing, Pap test plus high-risk HPV every 5, or just a plain Pap test every 3 years. Post-hysterectomy, and they have not had any cancer or abnormal cells, maybe uterine fibroids or something like that was the cause of why they had theirs, but it was not a cancer or pre-cancer diagnosis. The recommendation is stop. If women 65 and older, they can stop their screening Pap test if there's no history of CIN2, and that's like a more pre-cancer type cell or dysplasia cell or higher, with 3 in a row negative Pap tests or 2 consecutive co-testing. That means the screening Pap plus the high-risk HPV in the past 10 years with the most recent in 5 years. The United States Task Force, pretty well similar, age 21 to 29, screening Pap test every 3 years, age 30 to 65, either screening Pap test alone or the high-risk HPV testing alone every 5. So it's 3 and 5, or co-testing every 5 years. And again, over 65, again, the same thing. With evidence of negative screening, they can stop their Pap test as long as they've had 3 negative in a row, or 2 consecutive negative co-testings in the last 10 years, with the last being 5 years. This one's a big one for me, and I have a lot of patients that I really talk to about colon cancer. Colon cancer can be detected very early if there's polyps that are prone to grow into colon cancer. And so colon cancer screening is very important. I think patients, not without risk, there's always risk with any invasive procedure, but this can help prevent colon cancer. I worked in oncology right after getting out of school, and I've seen the colon cancer treatment. And it's not an easy treatment for patients, but early detection, has a higher cure rate And if it's a polyp not yet grown into a cancer, it can be removed and then more frequent surveillance with colonoscopies thereafter. In 2019, American Cancer Society estimates there'll be 101,240 new colon cancer cases, 44,180 rectal cancer cases. Colon cancer is the third most common cause of cancer, excluding skin cancers. Overall, for men, 1 in 22 will have colorectal cancer diagnosis, and 1 in 24 for women. And it's the third leading cause of cancer deaths in the United States in both men and women, and second when women and men are combined for cancer deaths. They've declined over the recent years because of early detection with colon screening and removal of the polyps, the small polyps that can lead to it, and improved treatments for the disease. Remember, these are for average risk. If you have had polyps or a family history of colon polyps, multiple family members, or colon cancer in a close relative, you should not do anything but the screening colonoscopy or testing that way, because you're at higher risk. So these are for average risk. The American Cancer Society recently changed their guidelines as far as age. Usually it's age 50, but they recommend starting at age 45. So here's the high risk: a personal family history of colorectal cancer, a personal history of inflammatory bowel disease, Crohn's, ulcerative colitis, or an inherited colorectal cancer syndrome, Lynch syndrome, FAP, familial adenomatous polyps, or a personal history of abdominal or pelvic radiation to treat other cancer. That's high risk, and it's just recommended that you have a screening colonoscopy. But they recommend starting regular screening at age 45 by stool DNA testing or screening colonoscopy. And they should have age 45 to 75, they should have regular screening colonoscopy through their lifespan, every 10 years if it's clear, through age 75 is what the recommendation is. And then based on 75 to 85, decisions should be based on the patient's overall health, life expectancy, and prior screening results. So they recommend a FIT test, a highly sensitive fecal immunochemical test every year. These stools for occult blood every year, or the DNA, like the Cologuard that we're seeing so much more of now, every 3 years. And Cologuard's what we have in the United States for that test.
Does that work pretty well?
We've had several results that have all came out negative. Just know that if you come back with a positive because it tests for DNA, or if it comes back positive for DNA or fecal occult blood, the recommendation is you must have a screening colonoscopy based on that. And they come back pretty quick, within 2 weeks. After the patient sent it in. So they send you the test, you fill it up, send it back to them, and then they analyze it and then send us the test. So it's pretty quick turnaround time for us to get the results.
It would be more comfortable for people to do that at home instead of come in and do it.
Mm-hmm. And the research shows that there is a good outcome with this. So. Visual exams on colon and rectum, colonoscopy every 10 years, the CT colonography every 5, flexible sigmoidoscopy every 5, and then the frequency of tests depend on the results, of course. United States Task Force says adults should start at age 50 to 75. Routine screenings, adults age 76 to 85, decision on overall health, life expectancy, and prior test results. And the screening test and frequency they recommend are colonoscopy every 10 years, the flexible sigmoidoscopy every 5, the CT colonography every 5, and the flexible sigmoidoscopy plus the FIT test every 10 years, and then annual FIT testing in between there. And then they had the fecal occult blood test annually that are at, at our recommendations. And then the FIT DNA test, Cologuard in the United States for the DNA every 1 to 3 years.
Just curious, I wonder if you could turn that Cologuard, whatever you call it, into your insurance.
Yes, yes. It's considered a screening.
So. I would have thought so.
It's considered a screening.
That's the best thing they ever did was pay for colonoscopies, and because a lot of people didn't do it because they couldn't.
Just know this too, though, that if you have any findings on your screening colonoscopy, if there's any polyps or anything like that, masses or anything, the next test is not a screening, and so your insurance will be billed as a diagnostic study. I have patients that get upset.
Yeah, I'm glad you said that. That's true.
The American College of Gastroenterology recommend screenings at age 50, except for in the African American population, and they recommend age 45 for the African American population based on supportive information and research they've done. Though they do say the information is limited. Screenings can be stopped at age 75 with patients that are up to date and negative prior screenings. And those are colonoscopies recommended for those prior screenings and have less than 10 years life expectancy. The first tier test for American College of Gastroenterology are the colonoscopy every 10 years and FIT test annually. The second tier tests are the CT colonography every 5 and FIT fecal DNA every 3 years, and flexible sigmoidoscopy every 5 to 10. So these are based by tiers. Third tier, they say the capsule colonoscopy, there's limited evidence and obstacles to this test, and so they say it's third tier, and if they do it, it's every 5 years. Prior screenings less than age 85 should be considered depending on age and overall health and comorbidities. My mom and dad just had theirs, they're 81 and 80, their last one, and the doctor said, I'll have a good life.
Oh, good for them.
Unless something happens. So other things that we need to consider for women's health are immunizations. Immunizations are so important for the control of disease. Of course, here at Sullivan County Community Hospital, it is asked of us that we have an annual influenza vaccine. Influenza vaccine does not cause influenza. Some people still believe that.
I know that.
The tetanus vaccine, you should have 1 dose of Tdap, the tetanus, acellular pertussis, diphtheria, once after age 19, and then a TD every 10 years. And if you have not had one and you're older, a Tdap, then you should have one. If you have a new grandchild, a new baby coming, a new niece or nephew, before you go to the hospital, that person's OB may say, I want proof that all of your family that's coming to the hospital has had a recent Tdap, because if they haven't, they're not coming. And I had that with a family, one of my very best friends, she just had a grandchild, and the doctor required a paper when they came to the hospital that said they have been recently treated for pertussis, for whooping cough, to protect the babies. A meningococcal, age 16 or older, first-year college students who live in residential housing, if not previously vaccinated at age 16. We have some college-age students here, so those are important that they know that. Meningococcal B, healthy adults, age 16 to 23, a 2 to 3 dose series depending on the vaccination you choose. And then the HPV is very important to prevent cervical cancer. And it's females age 19 to 26, 2 to 3 doses. I'm only speaking to females today, but boys are included in that age group and recommended. And it also says, depending on the age of the initial vaccination, how many doses they should have. The shingles vaccine, we always had Zostavax before, and it was recommended at age 60, and it's still available. It's a live virus, and we recommend shingles vaccines. If you've had Zostavax, should I have the new Shingrix vaccine? The answer is yes. CDC does recommend that you get the new Shingrix vaccine. It's a dead virus. It's 2-dose series. You get 1 day 0, and then 2 to 6 months later you get the second dose. And that Shingrix starts at age 50. Shingles are very painful. And even if you've never had chickenpox or no documented case of chickenpox, should you get the vaccine? Yes, because it can prevent an adult case chickenpox. The pneumonia vaccine, Prevnar 13 is the recommended first pneumonia vaccine at age 65 or older, 1 dose, and then a year later we'll give a Pneumovax, so the PCV 23. And then 5 years after that you'll get another booster of the PCV 23. If you have, I'm not speaking to this group today, but if you have comorbidities, diabetes, COPD, asthma, heart disease, those kind of things, you'll be recommended to have yours early. So if somebody has those kind of illnesses, they need to talk about with their doctor if they've not had that conversation before. Hepatitis A vaccine, we did a clinic today here at the hospital. Is it recommended? Yes, it is. It's required for kids now in school these days. It was not in the past. It's 2 to 3 doses depending on the vaccination that's used. I had mine yesterday. So hepatitis B vaccine recommended for anyone working in the medical profession. Recommended schools. Our school teachers are vaccinated for hepatitis B, and that's a really good thing because they deal with blood and body fluids all the time with children. And that's my presentation today. Any questions?